Non-steroidal anti-inflammatory drugs, or NSAIDs, are drugs with no risk of addiction that can help to reduce pain and inflammation. Studies have shown that these medications can significantly reduce pain among people with low back pain. NSAIDs are available over the counter, which means without a prescription. As these non-steroidal medications are effective and easily available over the counter, you may want to try them to help control your back pain. Here, we present a way to help you track whether NSAIDs help you with your pain. As part of the inflammatory and pain pathway, the body produces enzymes called cyclooxygenases, or COX, which in turn produce prostaglandins. There are two types of COX enzymes, COX-1 and COX-2. NSAIDs reduce pain by blocking the COX enzymes throughout the body, leading to reductions in inflammation and pain. Unfortunately, blocked COX-1 enzymes can also result in thinner blood or reduced ability to clot and stomach problems, such as ulcers and stomach bleeding. What are the names of some over-the-counter NSAIDs? Aspirin, ibuprofen, naproxen. Most of the time, NSAIDs are well tolerated. However, they can lead to side effects including nausea, stomach pain, bleeding and ulcers, increased risk of cardiovascular problems, risks of kidney problems, fluid retention, interactions with drugs used to treat heart disease such as blood thinners and antihypertensive drugs, and high blood pressure. In general, people who have a history of stomach or bowel ulcers or bleeding generally should not take NSAIDs. People who take anticoagulant pills or shots, such as blood thinners, should use different medications for pain. You should talk with your healthcare provider if you want to use NSAIDs, especially if you are pregnant, have high blood pressure, diabetes, asthma, or a history of stomach bleeding, kidney, or liver disease. Side effects tend to be greater in older individuals. How do I know if NSAIDs can help me with my back pain? Given that NSAIDs are relatively well tolerated and can help with back pain, you may want to see if they can help you manage your symptoms. Start with ibuprofen, 600 milligrams of Advil or Motrin 3 times a day, or naproxen, 500 milligrams of Aleve twice a day. Only use one NSAID at a time. Take with food and adequate water to help avoid side effects. It may take several days or more of regular use to know whether the medication is having an effect. As such, we recommend tracking your pain for 1 week before taking NSAIDs on a regular basis, and then tracking your pain for 1 week while taking an NSAID. Please track your average daily pain on a scale of 0, no pain, to 10, worst pain imaginable, before and after starting an NSAID. What can I take if I cannot take NSAIDs orally? There is an over-the-counter topical preparation of a commonly used non-steroidal anti-inflammatory medication called diclofenac 1% gel or Voltaren. This medication is like other NSAIDs and can be applied to the skin over the area of pain. It is less likely to lead to stomach upset or bleeding than oral NSAIDs. Talk with your doctor about using it if you cannot take NSAID pills. You can try this by applying 4 grams directly to the back 4 times a day. Another option is lidocaine, a common local anesthetic that can be used as a topical patch or gel to decrease local pain. It is chemically different from the NSAIDs and will not cause problems with stomach bleeding. It is available in several over-the-counter preparations. As with all medications, please read the package insert before using. Multiple over-the-counter medications are available to people with low back pain who cannot take NSAIDs. For example, acetaminophen or Tylenol is sometimes helpful. The medication comes in various strengths, so carefully read the label regarding how many pills to take per day. Acetaminophen does not cause stomach bleeding. Talk with your healthcare provider if the number of milligrams you are taking is more than 2,000 milligrams per day. If the over-the-counter NSAID preparations are not helpful, there are a number of available prescription medications. It's often difficult to predict which medication may benefit a given individual. Talk with your doctor about available medications. Of course, if you cannot tolerate any medications or have a health condition, that means you should not take a medication. Your healthcare provider can review other options with you.